Thank you very much. Bueno, yo voy a hablar en castellano.
I will be speaking Spanish. I hope it's not a problem for anybody. I hope that you all have headsets. My name is Estibaliz Gamboa, and I'm in charge of the Active Patient Program at OSAKIDETZA, the public healthcare system here in this region, in the Basque Country. And I would like to tell you a little bit about the self-management program among equals, the online program that we have set in motion here. Self-care is basic for chronic patients, which is why in 2010, to face the challenge of chronicity, this program was launched, the active patient, in the Basque language, paciente bizia. We decided to work with a program designed by Stanford University, and we started with a pilot in 4 different healthcare organizations. After that first stage, one of the conclusions was that the methodology had to be adapted and customized to our own culture, our own communities, and ever since then we have our own methodology. What is the Active Patient Program? Well, it's a program for self-care so that patients with chronic pathologies and their caregivers can benefit from it. This is a program where the leaders of the workshops and are chronic patients or their caregivers. It's a program led by peers or equals. It's a peer-to-peer program. And apart from helping them with basic facts and information about their pathology, we also help them be proactive. We give them facts and information, but we also train them to do something with that information. And why did we decide to run an online program? Well, when we started working with the program back in 2010, we found that a good number of patients couldn't attend the meetings for the workshops because of their duties. We tried organizing workshops both in the morning and in the afternoon, but even so. Also, our region has some remote rural areas with sparse population, so organizing workshops there was logistically harder. There are certain pathologies as well where there's a huge social stigma, so some patients don't like attending workshops and being known to suffer from that particular pathology. That's why we decided a remote online program might be suitable. The main challenge was making sure that this program, which is based on practice makes perfect, a practical program with peers as leaders, as role models for other people to follow through persuasion. How could that be made successful in an online format with participants all in different places? Because we wanted a workshop that made people feel satisfied, that was practical and useful, and also making sure that the final outcomes were as good as we'd had in the face-to-face workshops. We decided to work with a company, Vively, that had been working with Stanford University for their online program. So a number of us at the Basque Healthcare Service, public healthcare service, OSAKIDETZA, had meetings with this technological company, and we started with some pilots in 2018. Originally, we had a target figure of 200 patients. In the end, it was 223 patients who originally enrolled for the online workshops, but that figure came down to 193 before the workshop was finally organized. Then 88% of the 193 patients who were sent their username and password, as I was saying, 88% of those 193 patients accessed the workshop at least once. So those would be patients or caregivers who had participated even at least partly. A total of 69% of them attended 4 or more sessions that we organized and covered all the tasks and activities they were asked to do. That graph shows that some 24% of patients were lost on the way. They dropped out, and we had been warned by the technological company that that was quite normal. That was to be expected. Vively knew and warned us. So I'm just telling you this, some 25% of the people who originally enroll or say they're interested will not fully follow the program. Just look at those figures. We've managed to bring down the average age of participants by 9 years. Why is that good news? Well, because we want to recruit those patients, chronic patients who are younger and who have not deteriorated over the years, because in the face-to-face workshops, the average age 62, whereas the online course would have an average age of 53 years of age. And there's a gender difference as well. More women doing the online workshops than the face-to-face workshops. And the bar chart at the bottom of the screen shows how most of the people who enrolled in the online workshop are people with higher level of education. This probably means that people who socially are more disadvantaged will probably not access the online workshops either. That's probably a very difficult barrier for us to overcome. At the end of the workshop, participants were sent a satisfaction survey, and some 45% of respondents said they were chronic patients. Over 40% were caregivers, and some 5% of respondents were both caregivers and patients, chronic patients. And then some 77% of the people who took the workshop were not chronic patients or caregivers, were just people who were interested in that particular pathology. 14%, sorry, of the total. We have there people with cardiovascular disease, muscular, skeletal problems, cancer, respiratory pathologies, well, a bit of a mixture there. In the satisfaction survey, 86% of respondents told us that at the end of the program they felt much better prepared to face and cope with their pathology. 83% of the patients really valued the fact that it could be anonymous. You could have an alias. You didn't necessarily have to enroll with your real name. You can imagine that when they posted comments, whether it was fears or doubts or facts, that's probably quite useful for somebody to just speak honestly without the fear of being judged. That's why we have that very high percentage. 83% of them valued it very highly. Some 4.15% out of 5 is the score for usability of the platform. Why? Because it's very intuitive. You don't need to know very much about IT to use it properly. And then we've also identified a number of areas for improvement, which we will do. But it's a very simple platform, really, for users. In our process, we wanted co-creation to be present. So together with Vively, the OSAKIDETZA, the public health care service here in the Basque Country, has been working not just with Vively, but also with participants.
So we asked them to help us, and we talked to them to see what they had improved. We talked to participants to see what they wanted us to improve, and we've also carried out some focus groups in order to see what improvements participants would implement. Now, one of the things where we can improve is the action plan. Action plan to make it slightly longer, to extend its duration. The different forums where participants were able to share experiences, they wanted it to be more chat-like forums. They also said that there should be more interactions in the forums and more deeper interactions, being able to talk about feelings, for example, emotions, more information about food and diet, and that there should be a professional as well participating in the group, someone who you could ask questions to if you didn't know something, if you wanted more information. Now, what were the achievements? Well, they talked very positively about responsibility, co-responsibility, assuming the co-responsibility for their own health. They had increased their awareness of their disease, their knowledge of their disease. They said they felt healthier, they had more positive thoughts, they had improved their habits. They said that they were able to manage stress better, and they were more consistent with regard to their everyday habits and routines. And if we look at the sort of spiritual side of things, they also said that they felt much better in themselves. So, as key points of the co-creation process, we've identified the following ones. The anonymity was very important, because that meant that participants felt that they were able to express themselves more freely. The training can be used for people with any type of pathology. So we can actually reach out to many patients using different structures and without actually having to make them travel. So in fact, and the workshops can be done simultaneously as well, because you can actually do more than one workshop at the same time, because you can do it from the comfort of your own home. It is scalable. You can reach out to many different patients. With regard to the platform, now we've seen throughout the entire process, both with our work with the technology company and then our work online, that we can improve different tools and different technologies in order to become more efficient. So that's important to do that, to maintain the platform. We've also seen that it is both sustainable and transferable. We were a little bit concerned about whether the online format was going to be the same as a face-to-face one, because when you're meeting face-to-face, there's some kind of climate, a feeling as complicity is generated between the participants, which really helps the process along, and it helps the exchange of information and knowledge. And we were worried that that wasn't going to happen in the online program. But in fact, it did. The mean age has been lowered, and in fact, the scope is broader. So that's good news for everybody. Thank you very much indeed.
Sorry.
Thank you so much. It was excellent. I'd like to start by asking the first question. The way we engage people is changing. online. What is your best advice to us, to the audience in the room and those that are joining us through live stream, around how to start to engage with people through virtual, online?
Bueno, a ver,
Now, a priori it is more difficult. It is more difficult to get participants to connect up to us, to connect with us. So here, the work carried out by the facilitators is very important. The work carried out by the people who are actually running the workshops. The fact that participants need to feel listened to, not judged, the fact that they are free to express their opinions without anybody judging them for it. If they do that, and also mutual support from their peers, all of this really helps participants to become involved and engaged in the process and to maintain their work in the workshop. Thank you very much.
In the room, do you have any questions? Any thoughts and reactions? Wonderful. A special thank you.
thank you.